A production fee for your Hometown Health Connection was made by Buffalo Healthy Living Magazine and its sponsors. It's no secret we're all getting older. According to the World Health Organization, 1 billion people in the world are 60 years or older. The number of people age 80 or older is expected to reach 426 million. The United States Centers for Disease Control estimates that 20% of people aged 55 or older experience some type of mental health concern. An anxiety, a cognitive impairment, depression, bipolar disorder, and sometimes you add the challenge of chronic pain, other health issues, and unfortunately for some, the onset of dementia. Loneliness and social isolation are key risk factors for mental health conditions later in life. And unfortunately, 1 in 6 older adults experience abuse, often by their own caretakers. Mental health conditions among older people are often under-recognized and undertreated, and the stigma surrounding these conditions can make people reluctant to seek help. And that's the focus on this edition of your Hometown Health Connection. If you think mental illness is scary, imagine what happens when we don't talk. If you're dealing with a mental health challenge, you are not alone. Approximately 1 in 5 Western New Yorkers are living with a mental health diagnosis, yet many of these people suffer in silence because of the discrimination that sometimes goes along with it. It shouldn't be that way. So we're starting a conversation to end the stigma surrounding mental illness. Join us as we share stories, struggles, and successes. When we talk about mental health, we're going to find help for everyone, find their voice. Before we meet our guests, take a look at this message encouraging all of us to look for a very important website to end the stigma of mental illness.
I wasn't getting out of bed.
I wasn't going to work.
I hid my problems from everyone.
I didn't want people to judge me.
I watched my daughter suffering.
I didn't know what to do.
Because you joined the conversation, we know we are not alone.
We are not weak.
We are not ashamed.
We are strong.
And help is out there. We need to ask for it. Join the conversation. Visit letstalkstigma.org.
Joining us for this important discussion are Matt Smith. You all know Matt, his work here at WBBZ. He's been the Executive Director of Prevention Focus since 2009, has been in the field of substance abuse prevention and mental health promotion for over 30 years. He serves as chairman of the PX21 and Erie County Collaborative of all prevention agencies in the county, and the Western New York Chemical Dependency Consortium, a coalition of all prevention, treatment, recovery, and harm reduction service providers representing all 8 counties of Western New York. Matt is proud to be a founding member of the Anti-Stigma Coalition and serves as the group's outreach chair. In that capacity, he leads the effort to get the messages of the campaign to the public and encourages others to lend their voices and support to the cause of reducing the stigma around mental illness. We'll meet Danielle Bateman, an older adult clinical specialist with Niagara County Department of Mental Health and Substance Abuse Services. Danielle has been in this position working with seniors 60 and older for about 6 years. Danielle also works with Niagara County Crisis Services as a mental health designee. Danielle has an undergraduate degree in social work from SUNY Fredonia and a master's in social work from UB, certified in trauma-informed care as well as trauma-informed motivational interviewing skills. John Jones is a senior social caseworker for the town of Amherst Senior Services. John has spent several years working in care coordination, crisis services, suicide prevention, and as a childhood intensive care coordinator. Welcome everybody to your Hometown Health Connection.
Nice to see you, John. Thanks a lot for having us on.
Well, you're welcome. Matt, we've talked a lot over the years working together with projects at the station about the stigma. And it's very fascinating to me now that there's an actual website and a whole mission to end this stigma. What is the stigma, and why are we in this day and age still concerned about bringing up mental health as something that should be shrouded in secrecy?
Yeah. LetsTalkStigma.org is the website. Would you like everyone, at the very least, to know that before we're done talking today, and go and visit that and look at the campaign, look at the different things that we offer. 16 organizations came together in 2017, all with feeling the same thing, that stigma around mental illness was still one of the main impediments towards people getting help, towards people seeking help, towards funding sources coming forward with adequate funding. It's the glass ceiling that all of us were butting our heads up against. For some reason, we still can't seem to get over that it's a normal, natural thing to be talked about in the same way that physical health should be talked about. person would walk around for months and months and months with a broken leg. They'd go see a doctor because it's the right thing to do. We need to get people thinking the same thing about depression, anxiety, all the myriad mental health issues that could possibly arise as the medical things that they are. Demystify, replace myths with facts, get people to understand that the talking is the right thing, and talking is really the path towards a better reality.
And we're not talking about when you say make a pledge, people are familiar with the telethon, and you make a pledge, you make a phone call. You're not talking about asking for a donation. You're talking about maybe anybody can take this, making that personal decision. And I'm going to read from some of the notes here that you've provided. Like avoid using words like crazy and psycho and you're nuts and insanity. Things that are derogatory, particularly for somebody who's dealing with mental illness, or you may not know is dealing with mental illness, and you use those words, and it's very harmful. So taking that pledge when you go to the website is really a personal choice.
And over 4,000 people have already done that. I mean, realizing the power of words, realizing that words do help to shape attitude and belief ultimately, and trying to be careful of those words. But also just a willingness to discuss the issue in an unafraid, candid manner is what we're really asking for people to consider doing, and talking to others about the exact same thing. Reaching out to loved ones, reaching out to people who you have influence over, to make them understand that should be a normal topic of conversation, as normal as going to the dentist or the doctor. This should be in that same category.
Danielle, you work a lot with seniors, and I really admire you for doing that. It's God's work, sometimes. But with that, the generation that watches this station sometimes look at that and say a mental health issue is something that they're not comfortable talking about. So tell us about your interaction with seniors and why it's so important to end that stigma.
A lot of the people I see say the first time I see them, I'm not crazy. I don't need counseling. And I think it's all about normalizing counseling's for everybody. It's important just to talk about your problems. Just having somebody to vent to sometimes is very helpful, and they get a lot out of that. It's a lot about education and normalizing.
And so we were talking earlier about socialization as well. How does that play when people are not feeling their best, and yet they get a chance to socialize? That must make them feel better.
Yes, I think a lot of people compare themselves to others, not just seniors. Everybody does that. And I think hearing, okay, I'm not the only person who feels this way, and not being alone with your thoughts is helpful. So it's very important for seniors to get out and socialize.
Yeah. And John, to pick up on the socialization part that we just mentioned with Danielle, tell us what you do in Amherst, and how important is socialization for the seniors that you work with?
Great question. I'm a social worker at the Amherst Senior Center, and we provide a lot of programming, a lot of classes. We have a congregate dining site there, and the socialization is so huge when the people there don't see one of the members. They're concerned, and they're asking questions. They look out for each other. We have a lot of the programs, exercise programs, financial programs, wellness programs, just to make sure that they're getting out in the morning and socializing. They express the reason I came today.
You had a great story of a World War II vet, a generation the greatest generation. Share that story, because it's really wonderful.
He comes in, has his hot cocoa. He doesn't always have his meal during the day. He prefers to eat at home, but he likes his hot cocoa, and he says it's just to socialize. He gets up, he comes to see his friends.
And you mentioned something very important just now about exercise and eating, and not only the socialization, but if somebody is feeling low, they have to take care of themselves in ways that make them feel better no matter what their age. So coming to the senior center, I'm sure they get a balanced meal, and they're able to get some guidance, and the exercise is very important. You got to stay active.
Very active, very important to be active. The meals are provided Monday through Friday, and the people come, they want to take part in their classes. We have aging mastery program through the county, which people sign up. We usually have a waiting list for that program. We have yoga, tai chi, a lot of exercise is important. The motion of life is to get out and exercise.
Yeah, very important. Danielle, we were talking in preparing for this program about sometimes when seniors are depressed or they have some mental health issues, they tend to abuse substances. Maybe they start to drink, or God forbid they start to take drugs. I've heard from other agencies where drug abuse among seniors is actually on the rise. What have you seen with respect to substance abuse in seniors?
We were actually just talking about that also. a lot of times, people say, I have my 2 glasses of wine after dinner. Suddenly it becomes a problem. As we get older, our metabolism slows and changes. We take different medications that affect us differently. Seniors often, lose weight. So things that worked for them before don't work anymore. Also, when people are alone and isolated, people aren't checking in on them, there's no checks and balances, and they don't realize, that has become a problem.
Yeah, and I would think, somebody that would be used to having a few glasses of wine in their 40s, it's very different when you're in your 80s,
Right.
as you said.
Right.
And Matt, we've talked about substance abuse among young people,
Mm-hmm.
with the agency that you work with Prevention Focus.
Right.
But it is prevalent among seniors, isn't it?
Oh, it is. And I think COVID didn't do any of these issues any favors. Again, the isolation that was going on for a very, very long time, the increase in home delivery services for things like this did increase actual day drinking and use behaviors. And unfortunately, some of those turned into problem behaviors.
We talk about this television station being a comfort for some seniors, with the programs that we run. And Danielle, you had a very interesting story about that. Some of the homes you've gone into, WBBZ-TV is on.
Yes, I do in-home counseling services, and when I go in, pretty much every home, it's on in the background. When I ask, what are your coping skills, what gets you through hard times, and a lot of times they reference Bonanza or specific comfort shows.
That makes us feel good.
Yeah.
Yeah. And Matt, I think, we talk about that socialization, and Danielle and I were talking before the program. Technology, if a senior can embrace the technology, that opens up a whole new world for them too, doesn't it, Danielle?
It does. That use of Facebook, just FaceTiming family members is very important. Feeling a part of the family, even if they can't get out and get to the family parties like they used to, things like that. And also there's telehealth services now, which we discussed, that if you cannot get out to counseling and you can't, physically leave your home, that's a great option.
Yeah, I know just in my own personal world, I'm sometimes very technically challenged, and I try to get over it and I work forward to do that. But seniors should be the same way. Just try to embrace the technology and learn it, because it really can open up a whole new world. They can connect with their families again and take a look at their grandkids and see what life is like.
I know my mother, who's now going to be 90 years old this fall, John, afraid of Facebook, but we have a thing called GrandPad, which is basically an invitation-only kind of posting site where all of 6 of her kids are expected on the regular to be posting photos of grandchildren and things like that. So she's able to get that going on.
Yep,
which is
and
nice.
you just had another grandbaby come into your life.
Yes, I've got 4 now.
Yes, so
Thanks
there
for
you go.
asking.
So when seniors start to face some of these issues, sometimes they're told, well, it's just, you're getting old. Your memory's going to fail, or you're going to start feeling pain. So they just accept it, but they don't really have to accept what we are defining as mental illness, because it's one thing to feel bad, but it's another thing to have a mental illness. Share some of
There's
that.
absolutely reasons why people might feel sad or down or blue. I mean, there's absolutely many reasons why that could happen. And the trick is separating that normal from something that could be then diagnosed or needs help. Loss, losing friends, losing loved ones as we age. Again, the physical health maybe not being what it once was. The losing of a job, which so many people help to define their self-worth, and moving into a retirement kind of phase. Yeah, I think really can play difficult with people. But the thing is, if you're feeling down, talk about it to somebody. Don't be afraid to talk about it. If it goes into the realm of something greater than just a momentary thing, great. Now we're on the path towards discussing it. And even if it is only just normal, regular blues, it's not bad to talk about it as a way to cope, to get out of that rut.
We talked a little bit about how you handle mental health. Some people treat it with medicine, and they look to certain drugs. Some people treat it with therapies. But John and Danielle, I ask you this. I would think that the mix of the two, if there's a true mental health issue, is probably the best route to take. John, what do you think?
I agree. Sometimes medicine is indicated. You talk to your professional, you talk to your doctor, but getting involved in the community. One of the other options is at the center, we have support groups. I offer a men's support group. When I started at the center, they noticed that a lot of the gentlemen were coming and talking to me. So they asked if I could start a men's support group. That's getting together, talking about men issues. You might not be comfortable to talk to your family or your, the loved ones, work associates. So coming privately to talk. We have a grandparent kinship support group. again, reaching out and letting others know what's going on. You're not alone. It's a reason to get up in the morning and get involved.
How about the difference between men and women dealing with this? You know, historically, men tend to shy away from even going to the doctor. You know, we're tough, we're not going to do this and that. Not always the best road to take, having done that myself.
Stereotypes.
Yeah, so how does that play into it when you deal with the seniors that you're working with?
It's a big part of it. And like I started to say, when I started, a lot of the women noticed men were coming and talking to me. You know, that they were reaching out because they had someone to talk to another guy. They didn't feel comfortable talking to a woman, per se. And women stereotypically tend to open up, share their feelings. But the idea is, I don't know if any of you guys have had it, but if you got a good friend you go to lunch with, you know, and you start talking, you start sharing that. It's rare, and we're seeing more and more of the morning breakfast clubs and guys getting together. So we're trying to mimic that.
I think every different subgroup you can think of has different rules of engagement, different values, different norms. And some of those are great, and some of those, unfortunately, get in the way of having the conversations that are so necessary to help people maintain their mental health. This idea of self-reliance, this idea of strength, this idea that if you somehow need to talk about this, you're weaker, or you know, it invites to some sort of criticism or feeling bad about it. And that's really what has to be overcome. Because again, if you had the flu, you take medicine, right? You go and see a doctor. This is the same thing. We have to make sure people are thinking that way. And every group you encounter has a different set of rules, a different set of mores, which you have to kind of fight through to get to the stigma issue.
Well, and he mentioned support groups, and we talked about socialization, and I think the big thing about ending stigma there is that normalization. I'm not alone. This happens to everybody else. My neighbor has never mentioned it to me before, but it just came up, and you know, it's something they're struggling with too.
So how do you know if somebody is just feeling blue or truly has a mental illness? And is it somebody that would come to you and say, I think there's something more here to this, or is it something you see as an individual dealing with that population? How does that determination get made?
I get a lot of referrals from family members. I get referrals from people who call in themselves, and a lot from rehab, you know, the VNA, Macaulay Seton, people like that come in. They see these people every day and say that, you know, something's going on here. Can you come talk to them? And that's all it is. When I first go out to see somebody, it's usually just a brief conversation. And from there, there's different assessments I can do to see if it rises to that level of an anxiety disorder, a depression disorder, and there's ways to treat those. And like we talked about, medication and talk therapy are both very important.
Let's talk, well, go ahead, John.
I was going to say, it's important too, like word of mouth. You know, people see changes in behavior. You know, mom's sleeping more. She's maybe not taking care of herself. She doesn't get her hair done like she used to. So the everyday behaviors change, and our loved ones are the best resources. You know, the people around us, the neighbors sometimes.
And that was where I was going to go, because the younger people in a senior's life, it could be an adult child, or you know, family members, or even a neighbor. If they see something, how does that play into it? So there's a daughter that's noticing a change in her mother, yet they don't want to say something because I'm not going to tell mom something's wrong, but there is something wrong. How does that family, younger people, play into that role of helping the senior generation?
I think it's really challenging. You've got a role reversal in this situation often as people get older, where, you know, I was the one in charge. I'm telling the kids what to do. Now they're going to try to tell me what to do. How well does that go over?
Absolutely.
So it's about persistence. It's about, I think, having the right information and really working on that relationship.
I was going to say, a conversation needs to happen, and you have that relationship, building the rapport that they trust you, and you're there to help each other, really.
Right.
Our seniors have a lot of knowledge, and they've given us knowledge. They've given us a lot, and I think that's important when we look at ageism, that the seniors really are contributing to society. Maybe different roles. You know, you're a grandparent, I'm a grandparent. Right. We help. We step in and help out. We got to be mindful of that we contribute as well, and sometimes we need something back, so we help each other.
I think something important to provide too is just basic education. You know, you don't have to say, well, you seem depressed. Maybe just mentioning what the symptoms of that might look like, and let the senior kind of mull that over. And I do see that, you know, my daughter-in-law mentioned she's going to counseling for X, Y, and Z. You know, I think it might be helpful for me too. So talk about yourself, normalize it, destigmatize it, definitely.
And they shouldn't feel isolated because all of these services exist in various ways. You know, this website is very important because it has a portal for all of those places that people can find out other information. It could be something as severe as crisis services where somebody reaches out on something very traumatic, or it could be something where they reach out to, you know, the Amherst Senior Center or the senior center in their community. So people should not feel isolated at all, should they, Matt?
They have to do a little bit of work, you know, but if you go to letstalkstigma.org, there are resources there. There are other places to get resources as well. Look a little bit, do a little bit of homework before you have that conversation with the senior in your life you want to talk about. And I would say, much like I would say to a person who's doing human resources in a company, is stick to the tangible facts. You know, I've noticed this, and this in a non-judgmental way, and talk about, well, maybe it could be something, you know, and let's get a person in here who really knows that can test to see if it's really something. And even if it isn't, what have you got to lose? Let's just talk.
Yeah. I know when I was on the board of the Alzheimer's Association, they would say that during holiday time, when families would get together, is when they would get the most referrals because people were together and they were noticing differences in their parents. But how do you know if it's a mental health issue or maybe it's dementia or a mix of the two? You know, it could be something, or you're kind of, the senior is going down that road. I mean, these are tough decisions to make, and you can't make them without testing and the proper medical vetting. But how does that play into it, Matt? And Danielle and John, I'll throw it out there, where dementia or Alzheimer's or something more significant, the onset of that might be seen in some of these situations that we're talking about.
It's important to talk to medical professionals, of course, like you said, the assessments. Danielle has referred to tests that she can do. But the symptoms, recognizing the changes. I too saw that with holiday time. People getting together, families noticing, you know, Uncle Harry just doesn't seem to be as well. He's not taking care of himself. Last time I saw him, he was well groomed, and now he's got a beard and kind of scrofulous. And so we want to make sure that people are paying attention, and then go to their medical professionals for the testing.
And it might be more obvious for if you haven't seen that person in a while, as opposed to people who are dealing with them on a daily basis, where it might have been more gradual change.
You see the changes.
You haven't seen them since the last Christmas party, and then you see that. It's time to say something.
Yeah, and generationally, I would think younger people maybe are more aware of not being negative and discriminatory when it comes to mental health. But seniors, I would think, just because of the generational background of, you know, hearing those things, those words that we used earlier, that's what they grew up with.
Right.
So there's, in their own mind, they're thinking, oh, if I have a mental illness, they start to just feel stigmatized themselves.
I think there's a lot of that. I think that there's, you know, as other things aren't what they once were.
The world's changed. It's a tougher world.
Yeah, no doubt.
Now, you work with Amherst, but Erie County has a social services center and a senior services center. So, you know, as we talked earlier, and you talked about some of the things that are out there, and sometimes seniors can go to these places, but do counselors and people who help go to the seniors? Is it
There are some
something
places
where you
that do
can
that.
reverse that polarity?
Jewish Family Services provides home counseling. The New York Connects is a good resource. Erie County Senior Services is wonderful. I refer a lot of our people to CELJ, or Center for Elder Law and Justice. They have a wealth of knowledge there.
Yeah, and there's nothing worse than a senior that's been abused. I can't even imagine, you know, from the guy that's going to prune their tree to, you know, they have to be aware of what they're doing on their cell phones. So there's a lot of things that seniors, you know, need to be aware of, and those that are caring for them. And Danielle, we talked about the importance of just being a neighbor. You know, if you have a senior next door to you or down the street, you should check in on them. The neighbors are as important as family, isn't it?
Oh, definitely. The bigger the social circle, the better seniors do, from my experience at least. Yeah, those neighbors that, you know, they usually grab their mail the same time every day, and I haven't seen them lately. Those are the people that are checking in. They're noticing the differences. They're keeping an eye on them.
I know there's a lot of stories with Meals on Wheels. You know, I'll just share a story. My mother, I got Meals on Wheels from my mom. She was starting to get a little onset of dementia, and I thought, you know, this was good. It's not that we couldn't afford the food, but it was the touch point on a day-to-day basis. And one day they found her on the floor, and you know, that was like a wake-up call for me to really pay attention. You know, and I think, and I say that and I share that because I think sometimes you don't want to, as a son or a daughter, come to that grip that, you know, something's really wrong. You know, so that Meals on Wheels is another agency to do that. So how would you suggest, Matt, somebody who is, you're faced now with my parent or my senior in my life is either having dementia or a mental health problem. How do you go about embracing that? Because it's tough sometimes.
Yeah, I think that keeping the lines of communication open on the regular enables you to have much more power in this certain situation. I think, as John pointed out earlier, it's very important to have medical professionals involved, the right people. So some of these can manifest
that
themselves in a
relationship.
regular doctor visit as the jumping off point, and hopefully, you know, the person in your life is good at listening to those medical professionals and takes advice and does what the right thing is.
When we talk about seniors and we talk about the aging population, the world is getting older and staying older.
Right.
You know, the longevity is very much prevalent. And I think, to your point, John, the younger generation can learn from the seniors. You know, it's very important.
They're libraries.
Yeah. Let's talk about the website again.
Sure.
And the importance of why people should go to the website, Matt.
Well, one of the things we didn't talk about yet, John, is the organizational members that are part of the campaign. We started out with 16 organizations that wanted to make a difference and got this started in 2017. We now have over 100. And there is a members tab on the website where, if you're a business or if you're a church group, any kind of social group at all that would like to get involved, we need organizations to get involved to help get the word out, to subscribe to the newsletter, to use the different printed materials and distribute them, and the social media things, and getting people to watch our Facebook Live shows. All these things to help get the word out and keep the conversation going. We have the tools. We need more and more people to use them.
And it's easy to navigate. You know, the website is very easy to find. And I think that's important, that businesses and the community, you know, we're talking about social services agencies, but businesses too are supporting this cause.
Absolutely. Your workers are dealing with things on a daily basis, and mostly that you don't know about. But it's people who are mentally healthy and are taking care of themselves on the regular are better workers. So it behooves everyone to be involved in this conversation.
Yeah. Well, I'm glad we had this conversation, and it's very important. And I admire the work, particularly Danielle and John, that you do with seniors on a day-to-day basis, because you're making their lives better and extending their quality of life. You know, I think that's very important, that the quality of life of the senior. And more than anything, Matt, we want to end the stigma, right? We don't want to say bad things about, you know, we don't want to use words like insane or nuts or psycho. All of that's just terrible stuff.
We need to make sure it's easier. Again, conversation is the key. It should be as normal as talking about anything else.
Yeah, and pay attention to the seniors in your life. I want to thank our guests for being here today, Matt Smith, Danielle Bateman, John Jones, for this important discussion. And let's take another look at a message that you're going to see here on the station, and one that we hope that inspires you to end the stigma.
I am an orientation and mobility specialist.
I'm a lawyer.
I'm a firefighter.
I'm an advocate.
I'm a sister.
I am a mother.
I'm a friend.
I am me.
I have bipolar disorder.
Depression.
On borderline personality.
I'm not embarrassed.
1 out of 5 people lives with a mental health condition.
We're all people, and if we talk about it, there's hope.
Thanks for joining us on this edition of your Hometown Health Connection, presented by Buffalo Healthy Living Magazine. Be safe and be well. A production fee for the preceding presentation of Your Hometown Health Connection was made by Buffalo Healthy Living Magazine and its sponsors.